Well, hi, this is Just Be Well. I'm Tom Salt, a medical doctor and functional medicine practitioner.
I'm Elizabeth, a registered nurse and wellness coach.
And I'm adjusting the tripod. So we have been talking all week about allergy, and hello, Yolanda.
Yolanda.
We've been talking about allergy, and we started off with diet and lifestyle. And hi, Kate.
Okay.
So it's diet to eliminate the allergens or environmental modification to eliminate the allergens and to rest the gut. Why do you start in the gut? Because most of the immune system lives in the gut. 70% of the immune system lives in the gut. And then, so talk about a 5R program. We talked about that on Wednesday. And the last R, Rebalance, really talks about all the rest of the areas of the functional medicine matrix. So it steps outside of just gut and digestion absorption and goes into the rest of the matrix and helps with stress management and all that kind of stuff. And then we talked about adding on top of that specific supplements. We talked about quercetin and stinging nettle and NAC and fish oil. Somebody in the comments brought up curcumin, which is one of my favorite anti-inflammatories. And so we kind of went through all those things. And today we're going to talk about SLIT, sublingual immunotherapy, LDA, which is low dose allergy therapy, and LDI, low dose immunotherapy. So we're going to talk about those three things today. We're going to obviously, as always, take your questions. And but first, we're going to start, because it's Friday, and Yolanda already said happy Friday. Happy Friday. I'll give you the recipe for this. Oh, was I too quick? So this is a margarita. This is a health food margarita. Homemade. So 1 full lime, 2 jiggers of, I like añejo. I don't usually pollute my tequila with all these extra ingredients, but so 1 full lime, 2 jiggers of tequila. In this case, I think it was Los Tres Generations or Trace Generations. Could have been Jose Cuervo, or not Cuervo, Jose
Cuervo.
No, I don't think so.
It wasn't, but
yeah. Anyway, I like añejo normally. With a margarita, it doesn't matter. But and then what did I tell you would happen? Are you going to go swimming? The dog is about to go swimming. He was just
Otto.
Hopefully he's just looking to sample some goose poop and that kind of thing. And what's the
Cointreau?
Cointreau.
It's like
1 jigger of that. Little splash of olive juice, a couple of olives for that saltiness.
2 olives, for salty, and
that is
a small amount, like
simple syrup. One jigger of simple syrup.
Just a little bit to take the edge off. Right?
Yeah. So there's the margarita, and
very important.
Keeps, as I like to say, I drink to make you more interesting.
Yeah, I drink to make you more interesting. No, I'm just teasing. We all know he's interesting.
So hi, Jody. How are you?
Hi, Jody.
Looks tasty. Yes, it's very tasty.
It is very tasty, refreshing.
So back to the topic at hand. Which is allergy, and hopefully you're not allergic to tequila. So allergy is an abnormal response. It is a loss of tolerance to an antigen. So it can be an inhaled pollen, it can be a food, it can be any number of things. And the normal way of treating allergy is, number 1, avoidance. Number 2, perhaps medications like antihistamines and that kind of stuff. And we talked about the alternatives to all those medicines over the last couple of days. And then if you get to the point of allergies, usually if you go to a standard allergist, they will talk about allergy shots. we do something that's similar to allergy shots, except for it's not so painful. It's under the tongue drops. So what allergy shots and what these under the tongue drops do, called SLIT, sublingual immunotherapy, they help your body build up something called blocking antibodies. So you have an antigen, let's say my finger is the antigen, and it's in your blood, say, and it gets attacked by an IgE antibody, and that then causes it to do a bunch of complicated stuff that results in the release of histamine and leukotrienes and prostaglandins and all kinds of stuff that make you swollen and itchy and miserable. So it's the IgE that attacks the antigen. If, on the other hand, you convince your body to make a whole bunch of IgG, the IgG attaches to all the antigens all the way around the thing, and the IgE can't attach. Because IgG is voluminous, there's lots of it, and IgE is just a little bit. So that's how standard allergy works. It actually increases your immune response to this thing. Now, some of you might wonder, well, gosh, my holistic practitioner did IgG allergy testing. Yeah, that's a bit of a problem because IgG can also be reactive. So you're reducing the reactivity, but you're still causing an upregulation of your immune system. But it still works very well. I've got tons of patients that use SLIT, and it reduces their need for asthma medicine. It reduces their need for allergy medicine. But you have to carry this little bottle around. You have to take it, like if it's for foods, you need to take it, at least once a day. Some people take it before each meal, depending on how severe it is. And then over time, maybe you only need to use it 2 or 3 times a week. Sometimes you'll find that you can use it 2 or 3 times a week until a big bloom of your allergen, then you have to use it every day. So, there's a little bit of fiddling with it. But it works really well. It's convenient because you don't have to come into the doctor's office for shots and all that kind of stuff. The first set of it comes in a little box and you just work your way up, and then you get maintenance doses after that and you just keep using it. With all of these therapies, you really need to do it someplace between 1 and 5 years. SLIT is usually between 3 and 5 years to get lasting results from it. So it's not like you just take it for a few months and you're done. It's kind of a commitment.
It's a commitment, yeah.
But it works really well.
Where LDA is a little bit typically less of a commitment time-wise.
Yeah.
Closer to a year or 2.
Yeah, so LDA, low-dose allergy therapy, is a little different. It's a much lower dose, like on the order of 100 or 1,000 or even multiple thousands of times less concentrated antigen. And it actually works by restoring Th1, Th2 balance. So those are 2 parts of your immune system. And it upregulates Th helper cells and balances Th1 and Th2. And what that does is it increases your immunity from the point of view of infection, and it decreases your immunity from the point of view of allergy. So it makes you more tolerant to common allergens, whether they're foods or chemicals or environmental or whatever. And instead of increasing blocking antibodies, it balances this Th1, Th2 business and actually calms down your immune system without overstimulating it. We give that once every 7 weeks. So we send you a little dose once every 7 weeks, squirt it onto your tongue, you're done, easy peasy.
Monitor for your symptoms, see if you're better, worse, or the same, and then we know what to send you next time.
Well, and for LDA, usually it's it's not too fiddly with the dose. Although for really sensitive people, we might start with a really even more low dose and slowly work up to the more common dose. And then LDI, we've talked about before. LDI is low dose immunotherapy, and we can use that to retrain your immune system against a number of things. So, for instance, we know that certain bacteria are associated with certain diseases. As an example, some people have sensitivity to yeast or mold. Well, we can make antigens out of yeast or mold. The trick with LDI is finding the right dose. So we kind of guess based on our experience and based on the person's individual sort of habitus and constitution. We choose a dose, and it might be anywhere from 30C, which means that it's been diluted 1 to 130 times, up to 5C or 4C or whatever. Typically start probably in the 15 to 20 range, and then increase every 10 days until we start to see some inkling of progress, and then we slow down and get really precise and find the dose. And for many people, when we find the dose, it can be miraculous. Got 2 newfies who are smelling the water. I'm very worried they're going to go swimming.
They were just groomed.
I know, if those guys go swimming, I'm going to kill them. Anyway. So that's LDI. These are both, or all three, are sort of alternative ways to think about allergens. And as we've been talking about all week, these are not first-line therapy. No. These are after you do all the diet and lifestyle and functional medicine stuff, then you add this on top. And especially for people who can't get out of, like maybe you own a home that has water damage, and you just you can't afford to rebuild your whole house or whatever. So sometimes it's helpful in situations like that. It's really, the LDI especially is really helpful for people who have say Lyme disease, and their immune system is so stuck on peripheral craziness that can't focus in on the infection, or for people who have MS, or who people have other collagen vascular autoimmunities. Sometimes LDI can be really, really helpful. Sometimes we make autoantigens for people who have, as an example, say inflammatory bowel disease, Crohn's disease, or ulcerative colitis. We'll actually collect their stool and dilute it, and then pull it through a syringe that has a filter on it that sterilizes the material, and then dilute it again. And by using that, we call it an autoantigen, where we've made the antigen out of their own stool. That can be really miraculous. It sounds pretty gross, but it's been filtered and sterilized. So we can also, if somebody has, like, I had a patient one time with what's called red man syndrome, which is total body eczema. And on a million meds, steroids, everything, and it wasn't really going away. We literally just scraped some of the plaque into a little container, diluted it, shook it, get it all mixed up. Again, pulled it through a syringe with a filter on it and made dilutions. It was miraculous. Nothing else worked, but that worked. However, none of these work 1,000% of the time, or even 100% of the time. So it's just one of many tools that we use when we're trying to help people. So let's see. We missed saying hi to Misty and Doris and Alyssa. Hi.
Hi.
And there was Jody. It's great. Thank you all for being here.
On
and
Friday evening.
On Friday evening, I'll toast all of you. Time for another drink. And I'm wondering what questions you guys have about allergy that we've been talking about all week, or functional medicine in general, or what it might be. And we can certainly talk more about allergy too, but that's sort of the overview of SLIT, LDI, and LDA. And the International Conference for Functional Medicine is starting today. Or maybe it started today, and there's a reception for practitioners in about 30 minutes, and all virtual. So I'm going to check into that after we're done here and see what's going on.
So Yolanda has a question.
Okay.
Does LDI help with myasthenia gravis too?
It can. Like I said, it's not an absolute cure. Nothing is, but it's absolutely worth trying. Myasthenia is an autoimmune disease, and autoimmunity means that your Th1, Th2 systems are out of balance, and that is exactly what LDI can help with. So, yeah, we've seen it work with many autoimmune diseases. I cannot recall using it in a patient, but I'm friends with the guy who actually invented this thing, Ty, and he has used it for myasthenia. So yes, absolutely, I think it can. So other things, though, and I know that you are very diligent with your diet and all those things, but I think it's easy to fall into done that, been there, done that, bought the T-shirt, and to sort of slack off on that stuff. I would encourage anyone with an autoimmune process to read. So go on TED and look for Terry Wahls, W-A-H-L, M.D. Terry is a colleague of mine with the Institute for Functional Medicine, and she has MS. And through diet and lifestyle, she went from being in one of those wheelchairs where you have to be really reclined back because, she would swell really bad and everything, to going hiking, riding a bike. It's amazing. So this is no joke. This is real serious medicine for real serious problems. But it's very counter-cultural. By that I mean they don't have spinach ice cream at the Dairy Queen, so you're not going to be going there. It really requires some very serious dedication and deciding what's important, right?
Right.
And that's not always easy, and that's where coaching comes in. I think getting your head around, it's like if this was medicine, which it is, by the way. If this was medicine and you were holding it and you were thinking, I hate this stuff. I do not want to take this stuff. This is awful. Ugh, I don't like it. How is that going to work?
Right.
Compared to, thank God for the opportunity for this.
Even if you really hate it, even if you don't like the taste of it.
Yeah, I didn't say it was a milkshake, it's medicine.
If you still get it in your mindset that this is making me feel better.
Everything we do is information.
And have it with gratitude.
Yep.
Gratitude.
Every thought we have is information. Every emotion we have is information. Do you want to bathe your brain and bathe your physiology in positive information or negative information?
Yeah, I always like to tell myself, Elizabeth, your cells are listening to you. They're listening to anything that I'm telling myself or saying out loud. They're listening. Which
I think brings Brene Brown's comment even to another deeper level, right? Go ahead. I can never remember.
I have many conversations in a day, and a few of them involve other people.
Yeah, so those many conversations you're having that don't involve other people, they involve your own cells.
Yeah.
They involve your immune cells. They
your
involve
whole body is listening. Everything is.
Yep.
On a cellular level as well.
Yep. And so if you're the person who's kind of pissing and moaning and not very, the self-talk is negative, that's not helping you.
That's really not.
Find a better way. And it starts with deciding.
Intention.
The path to enlightenment, however distant enlightenment may be for me or you, the path to enlightenment starts with deciding. The journey of 10,000 miles begins with this first step, according to Confucius, and I think he was on to something there. So, that's, I think, the wrap on the week for allergy, unless there are more questions. I think we need some help from you guys to decide what to talk about next week.
Yeah.
Well, there might be something there.
Yes. being positive and loving yourself is half the battle. I think it's a lot of the battle, honestly.
Might be 80-20.
Yeah.
You know, I have a friend who is in a meditation group I'm in, and she's been meditating for years and years and years, and her revelation just recently was how powerful her inner critic really is. And it's so true. You know, we have an inner healer, and we have an inner critic. And sometimes it's hard to tell who's talking, right? So I would encourage you that if the voices you're hearing are not that you are adequate, that you are lovable, then that's not your inner healer.
Right. And sometimes we need to look at, okay, how are we feeling from the inner dialogue? And that can give us a clue to who's, talking currently. Like, how do you feel? And granted, there's some things we need to face. There's some hard things we need to sit in. But overall, I think if you just go off of your feelings, how are you feeling after you're having this internal dialogue, you can kind of be enlightened to who's actually speaking.
Yep. So, we used to talk about tapes. I guess they don't even make tapes anymore. So your internal MP4 file or MP3 file or whatever it is instead of your tape. But, the first step is to recognize that you have a tape. And the tape is something like, "You lousy sack of steaming dung," right? And then with time, instead of getting out the whole "you lousy sack of steaming dung," you just get out "you lousy," oh yeah, I'm not supposed to do that. And then as time goes on, you can replace that MP3 file with a better file that says, "Big deal. So what? Next."
Yeah.
It's not worth being negative about. Hi, Carol.
Hi, Carol. Thank you, Jody, for watching.
Yeah. So, Carol, you showed up just in time to see Elizabeth break her phone, and probably for us to sign off. Unless there are any other questions, I think we're going to let you guys go, and we'll finish our margaritas. Are we supposed to clink? I keep missing. You hold your glass up.
I was actually holding it up for them. I wasn't holding it up to clink. But it's okay.
Well, I felt like I was missing a boat or something. All right. So, okay. So next week it will be, unless there is somebody telling us what they'd like to hear about next week, you'll be at our mercy. And you might not like it, so you better.
Can't complain if you don't see anything.
That's right. And so far, the dogs have not gone swimming.
No, they're being so good. They're just laying in the grass.
Yeah, although he's turning in the wrong direction. All right, I'm going to yell at him. So good night, everybody. We'll see you next week.
Oh, one more thing.
Oh, one more thing. What is that? Cheers! Absolutely.
Thank you, Rita.
Yep.
Have a great weekend, guys.
Yep, bye.